This is John Allen. I'm a gastroenterologist from Minnesota Gastroenterology. I'm also the community counselor representative of the AGA governing board. I'm here in Washington today. My coat's off because it's 97 degrees and the humidity is off the chart. But I'm here on a really important mission. We're here with the Alliance of Specialty Medicine Fly-In to do legislative advocacy on the Hill. The Alliance is a specialty organization representing over 100,000 specialists, including gastroenterology. The AGA was one of the founding members about a decade ago when bills such as the Patients' Bill of Rights and the Health Maintenance Organization bills were hot. And we've been a member of the specialty organization for the last decade and worked with other specialists. We are here doing advocacy work with the senators and congressmen and people that really affect your practice. One of the ways they're affecting our practice right now, as every one of us know, is with the sustainable growth rate. The SGR cut went into effect several days ago. CMS held claims from January until June, and unfortunately the SGR was not fixed, so an automatic cut of 21% went into effect. So all of the claims that they've held now, which accounts for 50 million, are being processed with a 21% pay cut. We have pointed this out to congressmen, to senators, to really anyone that listens, and basically get the same answer, that as part of healthcare reform, some of the medical societies, specifically the AMA, cut a deal wanting a long-term fix of the SGR. Now, we all wanted a long-term fix of the SGR, but the fact is that they would not budge on this. So even temporary fixes of 6 months, 1 year, 5 years, which we would have been satisfied with, could not have happened because the AMA provided political cover for the senators and congressmen to say, we're not going to fix it. And so now we're in a situation where all of our bills are getting cut by 21%. Now, eventually, when it gets fixed, and it will get fixed, we will be made whole. But we're not sure whether we're going to have to resubmit claims. We're not sure when that's going to happen. And obviously running a business with that kind of unpredictability is very, very difficult. I had the pleasure of meeting with a number of staffers, plus congressmen from Minnesota. We've met approximately 50 other physicians from around the country and various specialties have flown in today and are on the Hill advocating for specialty medicine. Some of the things we point out are the fact that primary care medicine is in dire straits, and in fact, there are very few primary care physicians to take care of the population. So much of that work gets punted up to specialists. We wanted to make sure that they understood the added burden of work, the fact that Medicare and other patients need to have access to specialty medicine. One of the things we're very concerned with is the Independent Payment Advisory Board. This is a board of 15 people, and these 15 people work full-time at this board, so they can't hold other jobs. That means any practicing physician will not be eligible to be on this board. This board will be appointed by the president and will be essentially autonomous. So they will have responsibility, and their focus is to contain costs of Medicare. Unfortunately, some of the major providers in medicine have been carved out of the potential cuts. That includes hospitals, nursing homes, dialysis, and other types of providers. So when Medicare doesn't meet its budget, which to the surprise of all of us it won't, the cuts will come down as mandated by this advisory board, mostly falling on physicians. We have been advocating to at least get a physician voice on that board, if not do away with it completely. So now's the time to get active. We are facing a time where we have unsustainable cuts in the SGR. We're facing a time of uncertainty because we're not even getting paid. We're facing a time of independent boards doing things to our practice for which they're not accountable. Now is the time to get involved. The AGA has been at the forefront of advocacy for this. You can find information on the gastro.org website, on our blog, on the various other social media outputs that we put out. Follow this closely. This is affecting your bottom line, it's affecting how you practice, and it's affecting the future of our medicine and our children's medicine as well. So please be generous with your time. Contact your congressman, contact your senator, keep up to date on the AGA website, keep up to date with these issues, and try your best to help us provide a better care for our patients. Thank you.